I'm sitting in my office in Washington at this time as it appears that the House is on the verge of passing a major health care bill. This bill has so many problems to it, but I've spoken on the floor a couple of times, and this is the second video that I'm preparing to try to inform my constituents as to my position on this legislation that, as I mentioned in my first video on this, the Wall Street Journal has referred to it as the worst bill ever. But among the problems, it does cut Medicare by approximately $500 billion, so many senior citizens are concerned about that. And then in the Washington Post yesterday, there was a column by Michael Gerson entitled "Making the Young Pay for Health Reform," and it says that precisely because younger people have lower health costs, reformers want to draft them into the broader health insurance system so that their premiums can subsidize the health expenses of older, sicker consumers. Thus, in every version of reform, the young are required to purchase coverage. This mandate explains the political coalition behind health care reform. Insurance companies are willing to accept tighter government regulation on matters such as the coverage of pre-existing conditions, but only if they are given guaranteed access to millions of younger, healthier premium payers. There's a lot of shenanigans going on about this bill. And another example would be that the Hispanic members threatened to vote against this bill if there was strong language in there prohibiting illegal immigrants from qualifying under this bill and getting free medical care. Well, now in the Congress Daily today, this morning, it says immigration issue might be punted until conference. And so basically what they're doing, they're leaving out language that will assure that illegal immigrants don't qualify. So what that means is the bill that we will be voting on in the House probably sometime Saturday night or maybe in the early hours Sunday morning was one of the estimates on the news this morning. The bill we'll be voting on will allow illegal immigrants to qualify for government-paid medical care under this bill. Then also, this bill is going to have some what anti-abortion groups are calling fake anti-abortion language. In fact, the U.S. Conference of Catholic Bishops has come out against this bill, saying that the fake anti-abortion language that's in this bill is, quote, not a meaningful compromise. And so anyone who is against abortion should be against this bill because it will allow for government taxpayer-funded abortions, and that's very objectionable to many, many people, millions and millions of people across this country. Then also, this bill requires everyone to purchase insurance. Many legal experts and constitutional experts have said that that is unconstitutional. And to show you how ridiculous that is, people would think it was crazy if we passed laws requiring them to buy almost any other product. If we passed a law requiring them to buy more clothes, for instance, or all kinds of things. And so that's an objectionable thing. But then it's got subsidies in there for people to buy the insurance. And the subsidies go up to as high as 400% above the rate of poverty, which would be subsidizing the purchase of insurance by a family of four making $88,000 a year. Now, I guess that sounds good, and as I've mentioned before, someone told me a few weeks ago it's awfully easy to run as Santa Claus, and it's almost impossible to run against Santa Claus. But with a $12 trillion national debt, and that debt going up at just staggering, unbelievable rates, we can't afford to subsidize purchases to that level. And we have another column from the Washington Post just 3 or 4 days ago by Robert Samuelson saying, could America go broke? And he says, for the first time, we have to look realistically at the possibility of America going broke. And then all these different groups have come out on this bill. The National Federation of Independent Business, the Chamber of Commerce, the Franchising Association, the National Association of Wholesaler Distributors, the Associated Builders and Contractors. Almost every small business group in this country has come out opposed to this bill. And in this statement that they put out, they say, on behalf of hundreds of thousands of American businesses, we strongly support responsible health care reform that expands access and lowers costs for employers and working families. But with 7.2 million lost jobs and unemployment nearing 10%, the highest in 25 years, this bill is the wrong bill. Expensive new mandates on businesses will result in lost jobs, lower wages, less flexibility, and higher health care costs. The new government-run public option and massive cuts to Medicare would result in even more costs being shifted from the government to private taxpayers. So there are so many problems about this bill, mainly the unbelievable cost, which in almost all federal programs, the cost is lowballed, that we receive lowball estimates on the front end. And so these are just a few of the many, many problems with this very, very bad bill.